A nurse is preparing to give tolvaptan for a client who has syndrome of inappropriate antidiuretic hormone, SIADH, for which potentially life-threatening adverse effect would the nurse monitor? A. Increased intracranial pressure. B. Myocardial infarction. C. Rapid onset hypernatremia. D. Bowel perforation. Answer. C. Rapid onset hypernatremia. Rationale. Tolvaptan has a black box warning that rapid increases in serum sodium levels have been associated with central nervous system demyelination that can lead to serious complications and death. A nurse assesses a client with Cushing disease. Which assessment findings would the nurse expect? Select all that apply. A. Moon face. B. Weight loss. C. Hypotension. D. Petechia. E. Muscle atrophy. Answer. A. Moon face. D. Petechia. E. Muscle atrophy. Rationale. Clinical manifestations of Cushing disease include moon face, weight gain, hypertension, petechia, and muscle atrophy. A nurse PL answer care for a client with a growth hormone deficiency. Which action would the nurse include in this client's plan of care? A. Avoid intramuscular medications. B. Place the client in protective isolation. C. Use a lift sheet to reposition the patient. D. Assist the client to dangle before rising. Answer. C. Use a lift sheet to reposition the patient. Rationale. In adults, growth hormone is necessary to maintain bone density and strength. Adults with growth hormone deficiency have thin, fragile bones. Avoiding IM medications, using protective isolation, and assisting the client as he or she moves from sitting to standing will not serve as safety measures when the client is deficient in growth hormone. The nurse is caring for a client who has acromegaly. What physical change would the nurse expect to observe? A. Large hands and face. B. Thin, dry skin. C. Short height. D. Truncal obesity. Answer. A. Large hands and face. Rationale. The client who has acromegaly has an excess of growth hormone as an adult and therefore has a large musculoskeletal structure that is readily observed. A nurse assesses clients for potential endocrine dysfunction. Which client is at greatest risk for a deficiency of gonadotropin and growth hormone? A. A 36-year-old female who has used oral contraceptives for 5 years. B. A 42-year-old male who experienced head trauma 3 years ago. C. A 55-year-old female with a severe allergy to shellfish and iodine. D. A 64-year-old male with adult-onset diabetes mellitus. Answer. B. A 42-year-old male who experienced head trauma 3 years ago. Rationale. Gonadotropin and growth hormone are anterior pituitary hormones. Head trauma is a common cause of anterior pituitary hypofunction. The other factors do not increase the risk of this condition. After teaching a client who is recovering from an endoscopic transarachnoidal hypophysectomy, the nurse assesses the client's understanding. Which statement made by the client indicates a correct understanding of the teaching? A. I will wear dark glasses to prevent sun exposure. B. I'll keep food on upper shelves so I do not have to bend over. C. I must wash the incision with saline and redress it daily. D. I should cough and deep breathe every 2 hours while I am awake. Answer. B. I'll keep food on upper shelves so I do not have to bend over. Rationale. After this surgery, the client must take care to avoid activities that can increase intracranial pressure. The client should avoid bending from the waist and should not bear down, cough, or lie flat. With this approach, there is no incision to clean and dress. Protection from sun exposure is not necessary after this procedure. The nurse is caring for a client with acromegaly who is starting bromocriptine. What health teaching by the nurse about drug therapy will the nurse include? A. Take this drug on an empty stomach first thing in the morning. B. You will be starting on a high dose of the drug to ensure it will work. C. You might experience an increase in blood pressure in about a week. D. Seek medical attention immediately if you have chest pain and dizziness. Answer. D. Seek medical attention immediately if you have chest pain and dizziness. Rationale. Bromocriptine should be started on a low dose and taken with food. The drug can cause decreased blood pressure, including orthostatic hypotension. Serious effects such as cardiac dysrhythmias, coronary artery spasms, and cerebrospinal leak can occur therefore. The nurse teaches the client should seek medical attention if he or she experiences chest pain, dizziness, and watery nasal discharge. After teaching a client with acromegaly who is scheduled for an open transersphenoidal hypophysectomy, the nurse assesses the client's understanding. Which statement made by the client indicates a need for further teaching? A. I will no longer need to limit my fluid intake after surgery. B. I am glad no visible incision will result from this surgery. C. I hope I can go back to wearing size 8 shoes instead of size 12. D. I will wear slip-on shoes after surgery to limit bending over. Answer. C. I hope I can go back to wearing size 8 shoes instead of size 12. Rationale. Although removal of the tissue that is over-secreting hormones can relieve many symptoms of hyperpituitarism, skeletal changes and organ enlargement are not reversible. It will be appropriate for the client to drink as needed postoperatively and avoid bending over. The client can be reassured that the incision will not be visible. A nurse cares for a client who possibly has syndrome of inappropriate antidiuretic hormone, SIADH. The client's serum sodium level is 114 MEq, L, 114 mmol, L. What nursing action would be appropriate? A. Consult with the dietitian about increased dietary sodium. B. Restrict the client's fluid intake to 600 milliliters per day. C. Handle the client gently by using turn sheets for repositioning. D. Instruct assistive personnel to measure intake and output. Answer. B. Restrict the client's fluid intake to 600 milliliters per day. Rationale. With SIADH, clients often have dilutional hyponatremia. The client needs a fluid restriction, sometimes to as little as 500 to 600 milliliters 24-hour. Adding sodium to the client's diet will not help if he or she is retaining fluid and diluting the sodium. The client is not at increased risk for fracture, so gentle handling is not an issue. The client would be on intake and output, however, this will monitor only the client's intake. So it is not the best answer were. Reducing fluid intake will help increase the client's sodium. A nurse cares for a client with adrenal hyperfunction. The client screams at her husband, bursts into tears, and throws her water pitcher against the wall. She then tells the nurse, I feel like I am going crazy. How would the nurse respond? A. I will ask your doctor to order a mental health consult for you. B. You feel this way because of your hormone levels. C. Can I bring you information about support groups? D. I will close the door to your room and restrict visitors. Answer. B. You feel this way because of your hormone levels. Rationale. Hypercortisolism can cause the client to have neurotic or psychotic behaviors. The client needs to know that these behavior changes do not reflect a true mental or behavioral health disorder and will resolve when therapy results in lower and steadier blood cortisol levels. The client needs to understand this effect and does not need a psychiatrist, support groups, or restricted visitors at this time. A client is being treated for diabetes insipidus, D, with synthetic vasopressin, desmopressin. What is the priority health teaching that the nurse provides regarding drug therapy? A. The need to check the client's urinary specific gravity. B. The need to take blood pressure at least twice a day. C. The need to monitor blood glucose every day. D. The need to weigh every day and report weight gain. Answer. D. The need to weigh every day and report weight gain. Rationale. The client with D who takes lifelong hormone replacement will need to report significant weight gain to monitor for water toxicity. Water toxicity causes headache, vomiting, and acute confusion. The nurse is caring for a client who is diagnosed with diabetes insipidus, D. For what common complication will the nurse monitor? A. Hypertension. B. Bradycardia. C. Dehydration. D. Pulmonary embolus. Answer. C. Dehydration. Rationale. The client who has D has fluid loss through excessive urination. Decreased fluid volume, or dehydration, is manifested by tachycardia, hypotension, and possibly elevated temperature. Pulmonary embolism, PE, could possible as a clot in the lower extremity, caused by dehydration, could fragment and travel to the lungs. A nurse is reviewing care for a client who has syndrome of inappropriate antidiuretic hormone, SIADH, with assistive personnel. What statement by the AP indicates understanding of this client's care? A. I will weigh the client carefully before breakfast and compare with yesterday's weight. B. I will encourage plenty of fluids to promote urination and prevent dehydration. C. I will teach the client not to select high sodium or salty foods on the menu. D. I will assess the client's mucous membranes and skin for signs of dehydration. Answer. A. I will weigh the client carefully before breakfast and compare with yesterday's weight. Rationale. The client with SIADH usually has a fluid restriction, not an increase in fluids. It is the role of the RN rather than AP to perform assessments and provide health teaching. The AP needs to weigh the client daily and report a significant weight changes. A nurse teaches a client with Cushing disease. Which dietary requirements would the nurse include in this client's health teaching? Select all that apply. A. Low calcium. B. Low carbohydrates. C. Low protein. D. Low calories. E. Low sodium. Answer. B. Low carbohydrate. D. Low calories. E. Low sodium. Rationale. The client with Cushing disease has weight gain, muscle loss, hyperglycemia, and sodium retention. Dietary modifications need to include reduction of carbohydrates and total calories to prevent or reduce the degree of hyperglycemia. Sodium retention causes water retention and hypertension. Clients are encouraged to restrict their sodium intake moderately. Clients often have bone density loss and need more calcium. Increased protein intake will help decrease muscle loss. A nurse assesses a client who potentially has hyperaldosteronism. Which serum laboratory values would the nurse associate with this disorder? Select all that apply. A. Sodium. 150 MEq, L. 150 mmol, L. B. Sodium. 130 MEq, L. 130 mmol, L. C. Potassium. 2.5 MEq, L. 2.5 mmol, L. D. Potassium. 5.0 MEq, L. 5.0 mmol, L. E. pH 7.28 F. pH 7.50. Answer. A. Sodium. 150 MEq, L. 150 mmol, L. C. Potassium. 2.5 MEq, L. 2.5 mmol, L. E. pH 7.28. Rationale. Aldosterone increases reabsorption of sodium and excretion of potassium. Hyperaldosteronism causes hypernatremia, hypokalemia, and metabolic alkalosis. Hyponatremia, hyperkalemia, and acidosis are manifestations of adrenal insufficiency. A client is admitted with a possible diagnosis of diabetes insipidus, D. What assessment findings would the nurse expect? Select all that apply. A. Hypotension. B. Increased urinary output. C. Concentrated urine. D. Decreased thirst. E. Poor skin turgor. F. Bradycardia. Answer. A. Hypotension. B. Increased urinary output. E. Poor skin turgor. Rationale. The client who has D has excessive urination and dehydration. Clients who are dehydrated have decreased blood pressure, increased pulse, tachycardia, and poor skin turgor. The urine is dilute with a low specific gravity. The nurse is caring for a client with adrenal insufficiency. What priority physical assessment would the nurse perform? A. Respiratory assessment. B. Skin assessment. C. Neurologic assessment. D. Cardiac assessment. Answer. D. Cardiac assessment. Rationale. The client who has adrenal insufficiency has hyperkalemia that can cause cardiac dysrhythmias. Therefore, the nurse would monitor the client's cardiovascular status through frequent assessments.